Dr. Surajit Santra, consultant pediatrician and neonatologist at Bhagirathi Neotia Hospital, Rawdon Street. Hope all of you are fine after this pandemic period is being over. I just want to share my concern while I was going through a literature recently which was published in October 2020 in Times of India. It's about a 16-year-old girl called Aditi Rao. She was taken to a de-addiction center in Mumbai. She actually was so much addicted to screens that she used to surf the net throughout the night and stay sleepy throughout the day. And the situation became grave when she was taken to a de-addiction center. She became so furious that she used to injure and cut herself and was very much aggressive verbally and physically to her parents. Now, while such cases are rare and extreme, but lots of de-addiction centers are getting lots of children after this pandemic period who are not only suffering from this addiction, they are sacrificing meals while surfing the net, gaming or listening to the medias. But they also are suffering from withdrawal symptoms like drug addiction, alcohol addictions and so on. And when they are being denied to access to the screens, they are becoming very hyperactive and very much showing their tantrum to the parents. Now, after this lockdown period, these sort of incidences are becoming very rampant in every families. They are facing these sort of problems every now and then. Now, since the lockdown, this has become a new problem. Screen addiction has become a new problem other than normal health issues. So, this concern I thought of discussing with you and to understand what is screen addiction and its possible remedies. Now, what is a screen addiction? When you offer a screen to your child, it might be a small cell phone, it can be a tablet, it can be a laptop, it can be TV. But you might find that your child is sitting peacefully and playing games into the device. But actually in the brain, reverse thing is happening. What is happening when the child is listening or playing in the device? It is actually activating the brain's limbic system and it releasing hormones which is called stress hormones like cortisol and adrenaline, which makes the child very active, make the child ready for fight and flight. On the contrary, if their gaming device keeps on giving reward system, another neurotransmitter called dopamine is released from nucleus accumbens, and this release of dopamine in the body actually helps the release of all these stress hormones. So to keep a flow of these stress hormones in the body, this gaming system and rewarding system has to be continued so that dopamine flows into the brain. So the child's heart rate increases, the respiration increases, which are effect of all these stress hormones. The moment you take out this device from your child, the screen is being taken out from the child. The excess amount of the stress hormones which stays into the body makes the child very hyperactive. They show tantrums and keeps on doing a lot of nonsense activities. So this is in nutshell the physiology which happens in the brain when you offer your child to go through net or some devices which have a screen into it. Now, what are the causes which is making this scenario? As all of you can understand, after this lockdown, most of the school and extracurricular activities are online, and it has been found on an average it is 3 to 4 hours of online activities. But unfortunately, as because they got the device, the children are making this screen time 2 to 3 times higher than the expected. which is not acceptable. Now what happens? As a consequence, we are finding lots of kids are engaged with the screen, and I will give some statistical data. Like about 75%, you will be amazed, in the age group of 12 to 14 years are having a cell phone, a smartphone. About around 71% of the children have TVs in their bedroom. Around 84% of the kids have internet access. And lastly, it was another statistical data that children of this age group have found to like sending text messages around 30 to 40 after going to bed. So this is the gravity of the situation which our children is heading towards. And what is the consequence? Consequence is that they are stuck to home, they are becoming obese, they are playing very less, the social interaction to other children is going down. Around 50% of these children have sleep problems. They take at most 30 to 60 minutes to go to bed. Around 6 to 7% of these children have night fears. 70% of children often wake up in between their sleep. So sleep issues is a major problem for this screen addiction. And about 30% of the kids we are finding they are suffering from tantrum issues, hyperactivity issues. So this is the gravity of the situation. This is where we are standing now. So what are the remedies? What we can do about it? Firstly, please try to formulate a family screen policy so that your child know how much he is allowed to. The American Academy of Pediatrics recommends no screen less than 2 years of age, and if it is at all required after 2 years of age, it can be maximum 1 hour in 24 hours of screen viewing, and that too mostly because of some video calling where social interaction increases. You can see your grandma, grandfather, elder brother who is out of your city in the pandemic period. So the social interaction increases, not for playing games or surfing internet. If excessive amount of screen is being allowed in this age, it actually hampers the white matter of the brain, the development of the white matter of the brain, and also reduces or slows down the child's cognitive development. Now, another thing, when the small kids, you take the child to feed in the dining table, don't take the cell phone into the table. It has been a casual practice for the parents I have seen. What happens, your child gets attached to this iPod or screen and they don't enjoy the food. While feeding, they actually not only feed, they listen to you. They see your face movement, your hand movement, and their skill of motor and language development also increases. So please take out your own cell phone from the dining table so that their feeding activity and motor skill also increases. While coming back from your professional areas, once you are back, please try to give quality time to your child. Don't give iPod or screen to your child to make them calm down. Rather, take them out to a play area so that they can have social interactions with the other children. If possible, read out books with them, because these books actually make them understand. They listen to you, there is a face-to-face communication with you, and they see the pictures in the book. And these children should be very slowly understandable, not the iPod where the fast moving objects, fast colors are going in front of them, and these children's brain cannot adapt these things. So they need to calm down, slow down, adapt with you, and by this way their language, social and motor skills increases. Now for the bigger kids, you always try to monitor their internet access. This is another very important zone, because teenagers most of the time sometimes get engaged in the social media, Facebook, Instagram, where you have to monitor their activities, because they can enter in some restricted social areas, can watch pornographic movies, can send to some censored pictures to their boyfriend or girlfriend, which is not desirable. Please make them understand that whatever they see, whatever they access to the internet is always retrievable, always understandable and traceable. So they should do in a proper way. Another important thing, if your child is having a screen for their scholastic things, please keep the desktop in the center of the room or common area where you can see their activity into the screen, not in a personal area like room or bedroom. And if you are bound to give phone to your child for some academic activities, try to give a very cheap QWERTY phone, not a very expensive smartphones, and obviously monitor the sites they are accessing in the phone, and also monthly monitor the telephone or bills, where you can understand how much calls or SMSs they are sending it to. Another thing is that the TV, which is also a screen, so try to avoid the TV inside the bedroom of the child, because watching TV especially at night makes the child obese. They can also again have exposure to sexual contents and can reduce their sleep span. So TV also we should be in a common area, and watching TV also should be restricted in the stipulated time. Lastly, I just want to comment one personal thing which I see parents do, is that very tiny kids, when they are crying a lot, maybe refusing food, you just offer a phone or a screen to distract them. Please avoid this habit, as the reasons I have already told you. They cannot adapt these fast moving colors, their brain won't get adapted to that. When they are going to doctors or sisters, the stranger activity actually makes them cry. Please don't offer cell phone to make them calm down. I hope this whole discussion will make you understand the gravity of the new upcoming problem, which is a screen addiction in the children, and this problem starts right from the very early childhood till the adulthood. So be very concerned, conscious about it, and wish you all a very happy parenthood. Thank you so much. Thanks for your viewing.